Good afternoon, everyone. Thank you for being here. My name is Iana. I'm a professor in the Fowler College of Business, and I'm here today with Jessica, who's a doctoral student in the geography program. And we're going to talk to you about a program that I've been running for about 10 years now, and some of the research that Jessica's been working on for us since she was an undergrad, and now she's a PhD student. So I've had the chance to work with her for years. I'm very excited about it. So I run a program called Brightside Produce, and I want to give you an overview of that so that you can kind of see where the research is going. Essentially what Brightside realized is that a lot of underserved communities don't have supermarkets. Residents rely on corner stores, liquor stores, convenience stores, small markets for their food needs. But these smaller stores, they're not able to carry healthier products, and that's because of distribution challenges. So that's a lot of research in one slide. So we wanted to figure out how do we increase access to healthy foods in these stores, and we specifically focused on fruits and vegetables, and we spent a couple of years developing a new distribution model that focused specifically on the needs and barriers that these stores had, and essentially created a suite of services to service those stores, and that's Brightside Produce. So Brightside is a full-service produce distribution service, and specifically created to meet the needs of independently owned small stores. And we work with store owners to offer fresh fruits and vegetables in their stores. So we're a vendor, we come in and we offer all of the services like a Frito-Lay or a Pepsi to help those store owners carry fresh fruits and vegetables so that community residents can have access to not just produce, but to affordable produce. So here's an example of what we do. We have a van, we load it up, and then we visit our stores and we sell the produce, and we give them displays and marketing materials, and we're there every single week. So Brightside launched in 2017, and we started in National City. And we decided to start there because we'd been working with that community, and we knew that there was a need, and we already had some stores that we talked to that were interested in the service. And when we started with 5 stores. Since then, we've expanded to more stores within National City. And after 5 years of running the program, we started to do some program evaluation to see, okay, is this really working? Does this really matter? And so just real quick, some of the things that we found out, obviously, our partner stores all carry produce. On average, they carry about 15 items. And importantly, we just published a paper somewhat recently looking at National City specifically and different ways to kind of measure access. And so one of the ways that we did it was looking at reductions in public transportation time to a retailer that had fresh produce available. And so we saw a decrease in public transportation, average public transportation time to a fresh produce retailer. You can see on this map, the darker colors show bigger changes, and more than 50% of residents in National City live in the zip codes that experience travel time reductions. We also looked at walkable access, and so in a lot of underserved communities, sometimes public transportation isn't great, car ownership rates can be lower. And so we really wanted to look at quarter-mile access to a store with a fresh produce retailer. And so in this analysis, we found that through the addition of the Brightside stores, the percent of residentially zoned parcels, kind of our proxy for people with access, that had access to fresh produce within a quarter mile increased from 32% to 70%. When we did our initial push in National City, which was the first area that we serviced, we weren't scientific about how we selected our store partners. So we essentially looked up a list of stores that accepted EBT or also CalFresh benefits. We visited the stores, we kind of said, okay, this would be a good partner, this is a store that we want to work with, and then we recruited them and started providing service. And so this increase that we saw, we knew that we were servicing areas that lacked access, but we didn't know in advance if we would actually have that much of an impact. So after we finished expanding in National City, we selected the San Diego Promise Zone as our next area for expansion. But there, we brought on Jessica to help us with our site selection model.
Thank you. So when I started working with Brightside in 2021, providing spatial decision support, they were just beginning distribution into the Promise Zone. The San Diego Promise Zone is a 6.4 square mile area with about 80,000 residents that has long been characterized by a lack of access to healthy food. Our goal in bringing Brightside services into the Promise Zone was to define a systematic approach built on pillars of community engagement and scientific rigor that would maximize overall community impact. We attended public events and committee meetings to gather information from stakeholders about what elements were most important in determining what it meant to be a successful partner store. These criteria are directly translated into criteria and weights in a site suitability analysis that determined whether or not existing stores in the Promise Zone would be a successful and suitable partner store. In the figure on the right, you're looking at criteria, left, pardon. In the criteria, you're looking at criteria from the community feedback that were incorporated into the analysis and whether or not those elements had a overall positive or negative influence on a store's suitability. Based on the model of the 10-minute city, we used 10-minute walking service areas to define and visualize store coverage. In map 1 in purple, you see the coverage provided by existing grocery stores, as well as many areas in that red Promise Zone that do not have access. In map 2 in blue, we're looking at stores that were considered in the site suitability analysis, as well as their joint total coverage area. And then finally in map 3, we are seeing in blue the coverage areas for the 8 stores that were ultimately recommended based on location and suitability, alongside, of course, Brightside partner stores at that time in orange, and the coverage from other stores in red. So this is a map of 10-minute walking access to fresh produce across the Promise Zone. Compared to map 1 in the previous slide, we see that Brightside has broadly improved coverage across the Promise Zone. And thanks to Brightside, 92% of the population now has access to fresh produce within a 10-minute walk of their homes. So with coverage across the Promise Zone nearly complete, Brightside turned its attention to City Heights. City Heights is a 4.5 square mile community, home to about 70,000 residents. This community is extremely diverse and has significant Latino and Asian populations. And its food landscape is quite distinct from that of the Promise Zone. For instance, there are many, you can see the gray dots on the map there. There are many international and ethnic markets that do not have certain service areas because of their different target demographics. In addition, the southern portion of the community just doesn't have very many stores. Despite these obstacles, we conducted a suitability analysis, and Brightside has established 3 partner stores in City Heights that are improving food access for about 30,000 residents. Even when we consider the entire potential coverage possible, and that's represented in the orange and blue shading on the left-hand map, there is still a significant gap zone that is home to about 9,000 residents that don't have service options at this time. Moving forward, I see 2 ways to advance our current site selection model. The first is considering the fact that each community we've been in, as well as the stores themselves, have unique contexts. And so in my mind, the next logical step is using local spatial analysis to define a method for making context-aware, spatially heterogeneous service areas for stores, as opposed to the 10-minute walking area constant. In addition, in light of the City Height gap zone, we have this question raised about improving food access in areas without existing stores. And this goes, well beyond my area of expertise, of course. And obviously, introducing a new store is not the only solution, and oftentimes not the best solution. But if that decision is made, spatial optimization can be used to improve site selection to find an optimal location for that store. In the example of City Heights, putting a store at the starred location would provide access to nearly 80% of residents in that gap zone area. I'm confident that Brightside's approaches will continue to evolve to meet these and other rising challenges. And in the meantime, they're having a big community impact. With 27 stores covering 11.5 square miles, they are providing fresh produce access within a 10-minute walk of home to nearly 150,000 San Diego County residents. And in light of this success, It really showcases how community engaged and methodologically rigorous approaches like the one that I've described here can result in very significant positive impacts in local communities. Thank you.
This is me or if somebody
George, no,
okay. Amazing impact, very insightful work. I have two questions. One is that it seems like in the assessment in the categories, you rely on the feedback. How about like the demographics, like meaning the age, like, you know, for example, areas where maybe more senior citizens or lack of direct access, that's kind of like maybe be important. Maybe even like, is there areas where maybe more, are you talking maybe about accessibility in general, right? Like, I mean, for maybe disabled and things like that. So.
Yeah, thank you. That's a great question. Socio-demographic attributes like that for communities, the types of attributes that we consider to be like typically high risk for people who would have food instability are often coexistent. So someone is like, a household is likely to not only have low income, but maybe also low educational attainment, possibly also advanced age, possibly disability. Those things often go kind of hand in hand, especially at the community aggregated level. And therefore, using, for example, SNAP benefits, percent of households receiving SNAP, that's often a good indicator that also reflects many of those kind of concurrent variables that are happening behind the scenes.
That's really good. Do you think about, like, I mean, in some of the maps you have like a very bad gap zone, right? Have you, I mean, I think this would be an amazing partnership between local government and Right Side, because maybe, you know, the local government and the big supermarket can start like using this data and say, okay, this is actually beautiful because it's customer for them, but it's services that our local government can provide based on your insightful analysis. That's really not just a colorful map, it's rigorous analysis. So.
Yeah, and we have partnerships with the county, and when we started in National City, we had a partnership with the city to make sure that we really understood kind of where the residents were and the needs, but also to make sure we had buy-in and support. And so, so yes, we've worked with them, and City Heights is interesting because, as Jessica mentioned, there are a lot of stores as people don't see them as options for themselves as consumers to go shopping in. And so when we actually did the analysis, we found that there's actually a lot of food and a lot of access to fresh produce, but because it's in ethnic stores, when you ask a resident if they're not of that ethnic group, they're like, oh, there's nothing around here. And so that creates an interesting challenge that we have other researchers looking into who are more interested in like the geography of food and different cultural contexts. Ralph?
Is the analysis scalable? I mean, this is really powerful stuff. And I'm curious, like, if you had a different area, Detroit, Phoenix, Houston, and you, like, what would be the turnaround time, or what would be the requirements to do what you've done here and elsewhere? Like, is the analytical rigor one-off, or is it scalable?
Absolutely. I think the analysis is quite scalable with caveats. Of course, with this kind of community work, you want to conduct the analysis at as fine of a spatial resolution as possible. Therefore, depending on the size of the area of interest, it can become computationally intense. Also, due to the kind of unique community context that I touched on here at the end, there might be different factors that affect which existing asset store would become successful where another one would fail. And that might vary from community to community. And so there is still, I think, this crucial element of community engagement in the communities where you want to provide service. And I wouldn't feel comfortable just picking up my analysis necessarily and transferring it to Phoenix. But I do think the overall framework and a lot of the kind of behind the scenes computation can be easily applied and scaled elsewhere.
We've even applied for a grant to kind of build out the model and kind of have here are the components that you would need to have as a community that you need to contribute, local knowledge, context, and then here are the things that the model can then handle. We didn't get the grant. But that was kind of the thinking process, was we figured it out for a small scale, we figured out here, how can we then have other cities be able to use a similar tool?
Yeah, this could be powerful for like asset and services locations.
And not just for food,
Or not
just resources in general, yeah.
Quick question. In finance, we talk about the ability to take risks and the willingness to take risks. So it seems like you guys are solving for people being unable to access healthy food, so you're solving for this. But what about the people that are not willing to eat healthy food in those areas? Are you solving for this? Because not everyone is really interested in healthy food.
Yeah.
Not everyone knows what healthy food is. Are you solving for this as well, or do you have any plans to do that?
I mean, I think the way that we approach it is we make it available and then we see if the community buys it or not. And so some of our stores sell a lot and some of our stores don't sell as much. But we don't get into that, that level. But we know that people are using the service, and so someone wanted it, right? But yeah, we haven't been able to do any customer interviews either because that takes a lot of resources. So a lot of our analysis so far has focused on kind of these measures of access at kind of the community level. But again, proposing to do more in-depth research at the consumer and household levels to better understand what's driving the changes in eating behavior and what doesn't. Yeah.
Thank you so
Thank you.
much.